Now, I'm supposed to speak to you on prevention on PCOS. Now, what really is PCOS? Why should we prevent it? Can we prevent it? Whom should we begin with? How should we prevent its future problems? These are the areas which I would like to discuss. And I find that there is a lot of confusion between what is PCOS, what is PCOD, what is PCOM. So I would first of all like to get rid of that confusion. So I'll give you an example of a current scenario as we see it today. We have an adolescent girl who gets lots of acne. Her mother takes her to a dermatologist. The dermatologist, that is a skin specialist, treats her, but the acne keeps coming back. The mother's worried because the daughter refuses to go out of the home and socialize with friends, go to parties. And the mother keeps pestering the doctor. Why is she not getting better? So the dermatologist asks for an ultrasound. She does an ultrasound because she wants to rule out polycystic ovaries. And the sonologist reports it in the report and writes PCOD, which stands for polycystic ovarian disease, which should not be. The sonologist or the doctor who does the sonography should actually write it as PCOM or polycystic ovarian morphology. That means the ovaries are looking polycystic. Whilst PCOS is not a disease, as we call it as PCOD, that terminology also has been completely given up, and we call it PCOS, that is polycystic ovarian syndrome. Because today we do not know what really is the cause of PCOS. We need to understand what really PCOS is. And therefore, today there have been developed criteria from the entire world that we must have at least 2 things out of 3 present before we call it a girl having PCOS. So in short, she must have either irregular periods, number 1, or she should have all the signs of extra male hormone in her body. That is in the form of either acne, hirsutism, we'll discuss that later. And the third thing is she must have polycystic ovaries on ultrasound. So if 2 out of these 3 are sort of present, then only we can say this is PCOS. But what we need to understand is that in adolescents, there is a different way to diagnose. And that is what I will discuss with you here. Now, when we say we do ultrasound, it has been recommended by the International Organization of, Guidelines of Polycystic Ovaries that ultrasound should not be used for the diagnosis of PCOS in girls within 8 years of the first period. The reason is because there are high chances of multifollicular ovaries in the adolescent period. And this is the reason why we should not be doing it on adolescent girls. And therefore, if we have an adolescent girl where we have to label her as a PCOS, then all the 3 things must be present. She should have irregular periods, she should have signs of extra male hormone, and she should have ovaries looking polycystic on ultrasound. So the question then comes is, why are we concerned about calling it PCOS? Why should we prevent this problem? The reason is because when young girls present to us, they present to us from different age groups. They may present to us during the adolescent period when they are still young girls, when they have irregular periods, and their main issues as the girls come to us today is a lot of acne, lot of hair growth on the face where normally men have hair, or they may complain of hair loss from their scalp, or they always have opacity. 80% of the PCO girls are obese, whilst 20% may be still lean. Then they can come to you in the reproductive period. When a woman comes to me saying, I'm not getting pregnant, she may be having irregular periods, or she may have got pregnant, she's had miscarriages, and during pregnancy, she may develop very large babies. That could be because she's having diabetes coming in during her pregnancy. And the third is the 40+ time, wherein the woman has problems with her period. She has something like high cholesterol, she has a cardiac disease, she may develop, because of that, she may develop high blood pressure, and along with the obesity, we call it metabolic syndrome. And the last is, of course, as Dr. Rajan has already told you, that the girls, as they get older, they may develop cancer of the uterus. Now, the question is that why are we not stopping this? Because today we do not know what is the reason why a girl gets PCOS. Almost 10% of women have PCOS today. That means almost 1 out of 10 women has got PCOS. So it's a very, very common condition, and we need to understand it more. So in short, when we talk about periods, when the periods, what are normal periods? Normal periods are when it occurs every month, between 25 to 35 days of the period cycle. But at the same time, for the first year, a girl may still have irregular periods, but it usually settles down within a year or two. But then after 2 years also, the periods remain irregular, and the girl has only about less than 8 periods per year. Or if there's no period by the age of 15 years, or if there are no periods for more than 3 years after the first period, then there needs to be an alarm bell clicking, and the mother should take her to the doctor. The second reason is when there is clinical evidence of extra male hormone in the body. That is what we call androgens. Now, if that happens, we call it hirsutism, wherein the hair on the face is not the soft hair, but it is thick hair, which men have in their beard and mustache. So this kind of hair causes a lot of psychological impact on the girl, because she doesn't want to go out and she doesn't want to meet anybody because of the kind of ridicule can be caused. So in short, she keeps going to a parlor where she gets the hair removed, and the hair keeps coming back and gets worse day by day. And that is what we need to address and make sure that she's not having a problem of PCOS. So then you have a woman with acne, which looks as bad as this, or she may have hair loss from the scalp, which is a female pattern hair loss. That means it's not like the men. Like men have either baldness coming up in the front of their skull, or it may be at the back. But if you see over here, it starts around the parting and it keeps spreading further and further, and that is called a female pattern hair loss. All this is due to excessive male hormones in the body, and this can cause these kind of problems. So the next question is, can we prevent it? Can we stop all this, these things which are occurring to a young girl? We must know that initially we thought it was genetic because it tended to run into families. But now we have found that it's only about in 10% of girls that you will find that there is something like a familial clustering, in terms of that it happens within a family. But at the same time, we must remember that the baby who's exposed in the mother's womb to an environment which increases the male hormone can cause PCOS in that child if it's a girl child. Now, this is something we must remember. This is new research where it has been shown that mothers who have high male hormones in their body, especially those who have got PCOS, are likely to have babies because of increased levels of male hormone and insulin inside their uterus, which is causing the change in the baby. It may be not genetically transferred, but it may be because a mother is having it. And therefore, it's important for us to get the mothers under control before allowing them to get pregnant. The girl may reach, now this is something we have seen, that the daughters of PCOS mothers, if we compare them to the daughters of non-PCOS mothers who are not having PCOS, they may reach puberty early. In short, they get their first period very early, even by the age of 8 or 9 years. Then she may have the similar levels of, they have larger ovaries, they have higher insulin levels, higher male hormone levels throughout puberty. And this continues throughout adolescence and continues throughout the woman's reproductive life. And keeping in this mind, we have created an app called the Too Shy to Ask app. This app is an app which is meant for adolescents. It is completely free to download, and it is available on the Android and App Store. It talks about puberty and anatomy. It talks about reproductive and sexual health, gender equality, nutrition, exercises, vaccines, gender violence, and substance abuse. These are the various areas which young people are affected with, and therefore we recommend all mothers, we have a parents corner also in this, to read it and understand how to deal with your young girls. So question is, whom should we begin with? we should begin with maintaining a high degree of suspicion for PCOS in those children whose mothers are obese, especially if they have a lot of fat around their umbilicus, those women who are hirsute, having a lot of facial hair, those women who have PCOS themselves, those women who have got insulin resistance, in short, they are pre-diabetic, and those women who developed diabetes during pregnancy, and that baby born through that pregnancy should be held in suspicion. We should maintain a high degree of suspicion for PCOS in young girls who have got a precocious development of puberty. That means normally the average age of a girl having reached puberty is around 11 to 12 years today, may be extended to 13. But in some girls, even at the age of 8 or 9, you'll find that they are having hair underarms or in their underarms or in the pubic area. And that is what which should alert us that something is wrong. Then how should we prevent its future problems? First of all, we must remember that we make a correct diagnosis of PCOS. We must assess the adolescent for future risk. We must treat her current problems, and we must create awareness on the various lifestyle changes, try and maintain her weight, and that is what we have, Dr. Rajal has pointed out in her obesity talk. How should we start? We should look for and prevent gestation. As doctors who are treating pregnant women, we have to prevent diabetes in pregnancy. We have to educate our pregnant patients. We have to tell them, we have to educate all gynecologists should educate all women coming to us to have a healthy lifestyle for themselves and their families, and stimulate all obese women to join weight reduction program, get rid of all the excess weight, evaluate a PCOS woman completely, and not only for the symptoms. If she's come to you only for irregular periods, don't only treat that. Look for PCOS in all these patients and follow her up annually. And the assessment should also include psychological evaluation, because all PCOS women, they do have some psychological component coming into them. Like the young girl will psychologically worry, oh my God, how am I looking? What's happening to me? An infertile woman has so many social issues. She's not getting pregnant because of PCOS. She has psychological problems. So similarly, we must evaluate psychologically. We must assess them for cardiovascular risk, metabolic risk, and diabetes. And this psychological evaluation is important because if we do not do that, sometimes these young people can commit suicide. Because of this sexual dysfunction, there's eating disorders, there's body image problems, there's a bad quality of life, and there's depression. So in short, we must handle PCOS well. We can always control it. We cannot prevent it really, but we can control it. There's an excellent section on our PCOS Society website called Conquer PCOS. And this Conquer PCOS is an outreach program for PCOS patients. So get onto it and get all your information, ask all your questions, and we'll be happy to answer. So the take-home messages I have is that it is important to make a correct diagnosis, and we must look out for symptoms which include menstrual irregularities, all the cosmetic issues, infertility, diabetes during pregnancy, and increased presence of high cholesterol in women. Management depends on what the patient comes to us, and we must remember that this condition has to have long-term monitoring to prevent difficulties in these women during their lifespan and in their old age. So thank you very much for your kind attention.